So let us begin with the study of a new chapter, that is shedding of teeth. The term shedding deals with removal naturally, by nature or by physiology. So in the month of autumn, all the trees shed their leaves. Why? So that new leaves can come. The same thing is applied to teeth also. We have known and we have read that humans are diphodonts. Diphodonts meaning having two dentitions. One which we call as primary dentition, which develops when a child is very small, and then gradually this primary dentition is replaced by permanent dentition. So what is the need for replacing? Why can't we have just one dentition all through life? Because the child is small. When the child is small and is born, the needs are different. So initially the child will drink only milk. After that, when gradually the teeth erupt, the child will have soft food. Then gradually as the child grows up, the pattern of food changes. So from soft diet, the child will come to salads, maybe chapati, maybe paratha, and things become tougher and tougher. So the need for the teeth also varies, because those baby teeth are not supposed to be eating chapati and paratha. And that is why a new type of tooth has to replace that old tooth. Also, the skeletal size increases. So children have small faces, small height, and then gradually the face size also increases, the height also increases. So the teeth have to match that skeletal alteration of shape. And that is why, because those small teeth will look very weird in a large face, that is why there is a need for the dentition to be changed. So let us see why and how this shedding happens. What is so important in this shedding? Why do we really need to understand the process of shedding? So by definition, shedding is a physiological process. Remember, it's a natural phenomena. You don't have to do it. The nature has given provision for it to happen. So it's a natural phenomena resulting in elimination of the deciduous dentition. That means that if a permanent tooth is lost, then there is something pathological in it. It is not physiological, not intended by nature. So, shedding can be defined as a physiological process resulting in the elimination of deciduous teeth. The two main patterns of shedding are, there are two main reasons how shedding will happen. One is the progressive resorption of roots of the deciduous teeth, and second is the pressure exerted by an erupting permanent tooth. So now here we are coming in relation to a new term called as eruption. So eruption is the process of occlusal movement of a tooth. So when a tooth moves from its developmental position in the jaw to its functional position in the occlusal plane, we call it as eruption. And that is why eruption and shedding go together. If eruption doesn't happen, you will not have shedding. And till the time the tooth doesn't shed, eruption becomes difficult. It is not that eruption will not occur, but it becomes more difficult. So why is it necessary for the teeth to shed? As I told you, the deciduous teeth are small in size because the jaws are small. So small jaws, small teeth. As the child grows up, the jaws start enlarging. So the large jaws need large size teeth. And these large size teeth can't just come off by themselves. The previously present small teeth have to be removed, and they will create a space for these large teeth to come. These large teeth are important to maintain the masticatory load or to be able to chew whatever food the individual is eating. At the same time, it is important for the aesthetics, for the looks of an individual. Just imagine your face with small baby teeth, you will look so weird. So that is why the teeth size also has to change with the face and with the increasing size of jaws. So we move ahead with histology of shedding. What do we see histologically? There are three important things that you see in the histology. One is the osteoclast. These are the bone resorbing cells. Now, bone resorption is an integral part of shedding. The tooth is attached to the socket by means of periodontal ligament. So, the tooth is positioned in the bone. Till the time the bone doesn't dissolve, the periodontal ligament will refuse to let the tooth move. And that is why resorption of bone is as important for shedding as any other process. you.